Water Project Jamaica brings action to water conservation and the need for householders to be proactive in adopting water conservation strategies. That means we encourage householders to implement rainwater harvesting systems similar to what was done here at the Wortley Home for Girls. We can only make our way of life better if we work together.
Being able to offer my support and resources to the Wortley Home for Girls in an effort to promote efficient water usage is very humbling. The JNF Foundation is dedicated to water preservation. I myself am very passionate about the preservation of one of life's most invaluable resources.
This water project will certainly help us to make our payment to NWC easier. Thanks to JN Foundation and Agent Sasco,
Together we can.
Ladies and gentlemen, please welcome our panel.
I guess I take it over from here. Evan Caetano, your moderator for this panel. I hope you're hearing me okay. Mitigation to COVID-19 were social distancing, wearing of face masks, and most important, hand washing and observing proper hygiene. In the initial responses to the pandemic, travel was restricted and places of assembly such as schools, churches, sports arenas, theaters, bars, and restaurants were closed and parties restricted. Even funerals were perhaps still are restricted. The social or physical distancing caused us to work from home, and when some places reopened, it is with established protocols. We have become familiar with that word, protocols. So in order to meet the essential requirement of hand washing and hygiene, which is a key mitigation measure to COVID-19, were we prepared? What was the state of our water supply systems prior to COVID-19? As a water and sanitation specialist myself, working on issues affecting the water sector in the Caribbean, including Jamaica, the situation prior to COVID featured inefficient water utilities. The main reason for operational inefficiencies include aging equipment and pipes and limited water supply infrastructure, lack of a comprehensive asset management strategy and asset register to identify the condition of all the assets, lack of adequate network maintenance, theft, and unmetered consumption. These problems have led to the deterioration of networks, resulting in high physical losses and non-revenue water levels, and thus poor levels of customer service, unreliable supply with shortfall in potable water supply during dry periods, and low electromechanical efficiency of equipment. In turn, the main causes of these problems are inadequate funding for preventive maintenance over the assets critical for operation, lack of a long-term strategy for optimizing the life cycle of physical assets, lack of process and practices for operating and maintaining facilities, lack of capacity building programs, inefficient data handling systems for operation monitoring, lack of institutional learning strategies, and lack of government and utility commitment to improvement. This litany of issues is from a project proposal the IDB has with the National Water Commission, some of which is being addressed in the KMA project that we have ongoing, and this was pre-COVID-19. To address these problems, there is first the need for investments to deal with the deficient infrastructure, and second, to adjust governance arrangements to assure due attention to maintain efficient operations. Indeed, it is advisable to do both simultaneously. We heard Minister Albin Hill yesterday advising on how this financial shortfall is to be attended. And we also heard from other panelists yesterday with respect to these issues and how do we deal with it. So that sets the context. We have with us for this panel two persons working in the health sector. Dr. Valeska Stempliuk, I hope I get that right, of PAHO, WHO, representative in Jamaica, and Mr. Everton Baker of the Ministry of Health, who both will help us ventilate this question whether COVID-19 injected a new urgency for taking action to develop solutions to meet water demand. So we have an international expert and a local expert on this subject matter from the health perspective. As per instructions, each panelist will have 10 minutes for their presentation, which will be followed by a 15-minute question and answer session. As the moderator, I will give some thoughts at the end to wrap up the session. So without further ado, I call on Dr. Stempliuk to make the first presentation. Dr. Stempliuk, please, yours is the floor. I think you're on mute. You remain on mute. We still cannot hear you.
Yeah, no, I'm so sorry. I don't know why I can't unmute myself.
Well,
So
we
I'm
hear
so
you
sorry.
now. We hear you
Yeah,
now.
yeah,
Very
okay.
well.
Thank you very much. So you can see my screen as well, right?
Yes, we do. Thanks.
Because I can't anymore. So, but you can't see how you're seeing it. Are you seeing it as a full screen?
No, you need to put it on full screen if you wish.
I do, but
Otherwise, we could go with this. I'm sure it's okay.
no, but I can't see where I can change it. Sorry about that. Really apologize because okay, so so apologies for this problem with technology. Good afternoon, everybody. On behalf of Dr. Theodore Gandhi, PAHO WHO representative in Jamaica, I'd like to thank you for the invitation to be part of this workshop. So as I was already introduced, my name is Valesca Stempliuk. I'm PAHO advisor for health surveillance, disease prevention and control here in Jamaica country office. So I don't know how to change. So may
To move the slide, you just do it as normal.
the thing is, I can't see my slide. Where is it? Are it moving now? Oh, okay. Okay. Oh, okay. So to discuss about the topics that we was suggested today, I'd like to highlight three main topics. One is the status of water availability in healthcare facilities. Another is the healthcare sector demand for water and what COVID brought to us on respect of this already unmet demand. So those are the two documents that I base my presentation as a reference. So those documents and the one on your right that was published in 2019, but bring data from 2016, show us the baseline for the water situation, WASH in general, but I will cut off the water situation in the world. And then 2020, a new document was published updating the information. So what we learned from those documents is that in 2016, only 38 countries had data about estimation of coverage of water. However, from those data, we could estimate that 74% of the countries, they have basic water facility. That means the water was available from an improved source on the premise. 14%, they have an improved water source, however, within 1,500 meters from the premise, and 12% of the facilities doesn't have access to an improved source of water. This also shows that the difference between the regions were big. 51% of facilities in sub-Saharan African countries have access to water, instead of 87% on the southern Eastern African countries. There are other differences that shown here. 4% of the hospitals have access to water or have no water service, and other types of services have 11% of those doesn't have water service, showing inside the health system are also some divergence. 12% of the government's facilities or public facilities has no water, against 6% of no government facilities without water. between urban areas and non-urban areas also have some difference. 5% of healthcare facilities in urban areas doesn't have water service, and 15% in rural areas doesn't have a water service. Those data shows us that 896 million people have or use service healthcare facilities that doesn't have water to provide care for those patients. The 19 data highlight a little improvement. So we have 67% of the health facilities with water. 52 countries were able to produce some data. The difference between the area or regions keep almost the same. 46% in the sub-Saharan African doesn't have facilities doesn't have water, against 8-9% of facilities at Eastern or Southeastern Asia. In the least developed countries, only 50% of the facilities have some have basic water services. So then when we have this comparison, looking at the map, we can see that we saw some improvements in respect to the data availability. However, it's still 18 countries in the sample size still have at least 20% of the facilities with no water service. You can see here in the map in dark orange and red the countries that doesn't have an water service in at least 20% of the healthcare facilities. So if you cut only our region, Latin America and Caribbean, the sample size is very small, just 3 countries. No country from the Caribbean was represented in this first set. However, you can see also the variation between 46% of facilities with water in Peru to against 85% in Paraguay. So this is one important find that we see here. If you look all over the world, the difference of coverage of water is very important, is big between countries. So it's something that needs to be addressed. So the pipette water availability, we see that there is an inequity between hospitals and other healthcare facilities. So in dark blue, you see the hospitals, and the hospitals are more likely to have water. 60% of the hospitals have pipette water. However, less than 25% of the other healthcare facilities have water. The quality of water is also something crucial for health facilities, not only, but for health facilities, you know how important it is. And what you will see here is that this is an example from Costa Rica, and Costa Rica have 100% of the facilities with pipette water. However, if they test for the quality national standards before at the entering of the facility, you see the 97% of the facilities complying with the quality standards. However, if the test is done inside of the hospital, it decreased for 88% of the facilities. So there is a contamination of the water in internal sites. So in the continuity of supplies, just very briefly to show that it's not all the time. Even when the water is available, the continuity of supply of the water is also a problem in those facilities. When we cut off in our region, and those data are from PAHO, an assessment between 2010 and 2017, representing 14 countries, and 83 facilities, we see that the drinking water provided by at least 8 hours daily, we we could find it in 81% of facilities. However, the operative sink with soap and supplies for hand hygiene, we just find it in the patient areas, we just find it in almost 9% of the facilities. And operational sinks at the where the drugs and invasive procedures are performed, we found it properly in 37% of the facilities. So we saw that we have lacking many levels of supplies to perform the recommendations that we have in healthcare facilities. So the demand of the water is also varies from different health services, but of course everybody can appreciate that the water is vital for the activities that we perform at the hospital and healthcare centers. So what we see here is a minimal estimation, and we will discuss further that this minimal estimation is really something that falls very low when we compare with the recommendations that we have for a quality standards of care. So hand hygiene is an example, and is very important to highlight that is the single measure, most effective single measure for prevention of transmission of any communicable diseases, and the COVID-19 pandemic shows it to us, the importance of hand hygiene once more. It doesn't only protect us from contact to some diseases, but also from transmit diseases from another person. So in a hospital for more than 15 years, WHO has been pushing for increment for hand hygiene. And then here an example of when healthcare workers need to wash their hands. And following this recommendation, we have some estimations what it means in respect of water and demand of water. So if the healthcare workers clean their hands, not to only wash their hands, but clean their hands, and alcohol is also something that can be used. All the times that WHO recommend, that will be or can be up to 10 times per 12-hour shift. So that means for each healthcare workers, so that will take at least 60 seconds, but also between 1 and 5 liters of water. So for each healthcare workers, only for properly wash their hands to guarantee the safety of the care, we will have, I don't know, between 100 and 500 liters of water. So it's really a high level of demand of water to keep the quality standard. So from this experience with WHO,
you have two more minutes, doctor.
Okay, thank you. So from this experience from the healthcare facilities and showing the importance of hand hygiene, then in 2020, UNICEF led an initiative to hand hygiene for all, covering all different health settings to prevent diseases. And then it's come also jointly with WHO recommendation for hand hygiene to prevent COVID-19. So in conclusion, what you will see is, and you will know, is that hand hygiene is the most efficient single measure to prevent transmission of diseases. However, we still have 3 billion people, 4% of the world population, without water in their homes for wash their hands and with water and soap. We estimate that 1 billion people is in immediate risk of COVID-19 because lack of hand washing facilities. Hand washing facilities is also lacked in healthcare facilities, as I show, and also in the schools, and 900 million school-aged children doesn't have access to wash facilities, hand wash facilities. 1.8 billion people use health facilities that lack basic water service. As you saw, extended of this problem, we still don't know how big it is because there is major gaps in data. And coronavirus disease, COVID-19, exposed the key vulnerability of the health system in many different areas and in the wash services as well. So I think that's my last slide, and apologies again for the initial problems, and thank you very much for the opportunity. Thank you.
Thank you very much, Dr. Stanley. That was, oh, I noticed I am there double. You're seeing me double as well. So that was some overview of the world situation with respect to availability of water in healthcare facilities. We could go now to Mr. Baker, and he will give us a sense of this question, hopefully more in the Jamaican context. Mr. Baker.
Yeah, thank you very much. And on behalf of the executive of the Ministry of Health and Wellness, we are happy to be partnering with the JN Foundation in this summit. By way of presentation, I'm not seeing the presentation. Thank you. Go ahead. Okay, by way of presentation, of course, water is absolutely necessary for and has become more urgent in the COVID pandemic. Water is life, and it's not just essential to life, but it assists with the prevention of disease. As alluded to earlier, a lot of the world, like 40%, have no basic access to hand washing facility, and over 1 billion persons have infrequent access to water. The pandemic, as we know, we have seen over 3.2 million deaths, and probably this, maybe if the research is done, probably would have been more deaths, but because of the pillars that are used to prevent the transmission, the social distancing, the facial barrier, and of course, hand washing and hand sanitization, that would have stymied the transmission of the disease in a great path. And if we should look at other communicable diseases, like those traveled via the fecal-oral route, then we would have recognized that those diseases are reduced based on the measures and the improved sanitation that has been implemented worldwide and in Jamaica. Now, for the local situation, we, of course, have taken some serious measures in respect to the lockdowns, etc. in Jamaica. And of course, we would have had a managed approach in the early part of the COVID, but of course, it escalated in some instance. We are happy that the measures and the sensitization for hand washing has become essential and part of the Jamaican population. We have seen some innovation where persons would have, though they don't have running water, they improvise and provide kegs and so with taps in schools and different measures to ensure that persons would have access to running water. There are some facts about COVID and water, and WHO would have alluded to the evidence that the virus does not exist in drinking water or sewage for very long. It does not survive, and that's a myth that we want to dispel. And there are two main routes of transmission, the respiratory route and contact, and the surfaces, and hence why our hands are so important to be clean, because the hands move and goes to the mouth and to the respiratory areas, and of course that will transmit the disease. So because of COVID and in our environment, there are certain um, exposures to certain products like chlorine, especially in water, that will destroy the virus, of course. So we have to ensure that the water is properly treated, and that's one of the things that Ministry of Health does. We are the regulators, and we ensure that the water that is piped or distributed to homes in Jamaica and the industrial sector, it is portable and fit for consumption. So in terms of the general COVID demands, the lockdown, of course, would have increased the demands because we spend certain hours in our homes. And when we have the population increase over the 24 hours at home with children and all, we are going to be using more water. And the demand became even more glaring during this lockdown. If we look at the statistics, we probably would have recognized that the usage pattern would have shot up in terms of post-COVID, post-lockdown, or when you compare it to the pre-lockdown periods. And because of the consciousness that has been arose with hand washing. Of course, sanitation would have increased, not just in the homes, but in commercial and industrial settings. Persons who wash down buildings, they clean. Jamaicans are usually clean people, but it has become the thing of the day to ensure that, because we want to reduce the number of viruses that are in the environment. So all the commercial sector, as well as the domestic setting, became more conscious. From a legislative standpoint, of course, the Public Health Act is what governs our management of water, and by extension, we are looking at a regulation to ensure that in Jamaica, the requirements would have been up to the world-class standard. So we just don't allow water to be distributed, but there's a legal framework. And within the Ministry of Health, we have a unit, an engineering unit, in the environmental health unit. And of course, we receive development plans and we make comments to those plans. Of course, we want to strengthen our resolve to ensure that developments cater to the availability of water and the adequacy and, of course, quality and the consistency. You see, we're talking about water harvesting, we're talking about recycling, and we are talking about all those measures that will be necessary to ensure that we have adequate water at the time when it is most needed. There are adaptation and certain technologies come in play when we are saying to the manufacturers who are devising good methods to safeguard the use and the reduce use or overuse of good water. We are saying when you are designing and doing these things, the health and safety measures must be considered. Because we have seen some design that they are facilitating the transmission of disease. We have seen some faucet that has levers that you use it, but it conserves water because it's an automatic lock off. But the only way you can turn that tap on is to activate the lever. Those kind of technologies, they save water, but there's a risk. So with all the technologies, we are imploring the manufacturers to consider the health and safety requirements. And that's one of the things that we do, but we are encouraging persons to do that. And of course, with all the innovation and technology, we have to look at climate change, because of course, that is a long subject, and we know how well it impacts the water distribution and use. We have a new technology that we became aware of, the hydro panel, where water is extracted from the atmosphere and used. Again, we intervened because we said we have to ensure that even though sophisticated and will produce water from sources, we have to ensure that the standards are attained and maintained. Of course, we use different technologies to produce potable water from sources. We use a technology known as reverse osmosis. And of course, those we have to ensure that they meet the requirements to provide that kind of setting. And of course, the health facilities and so are important, and you would have heard in Dr. Valeska's presentation that we are speaking to what we use in health facilities. And of course, although we are speaking sanitation, we need a lot of waters, and Ministry of Health and Wellness, we are talking about conservation as well, and we expect behavior change. When there is demand and supply, of course, you will have overuse and lack of water, and especially in a climate change when you don't have a lot of rainfall. We're expecting persons to conserve water, and of course when you conserve, you have to ensure that you consider safety in mind, and of course how you store, how you preserve your water. Again, you have to be mindful of all those challenges. For health, and this is my probably final slide, for the healthcare facilities, we are trying to meet the requirements, and we are trying to get resilient health facilities, and we are partnering with PAHO as well as UNEP, and we are talking about rainwater harvesting as well as retrofitting some of the facilities in such regard. We are talking about, of course, a WASH policy where we are ensuring that we have standard sanitation practices. That's WASH mean water and water sanitation and hygiene, of course, and we are ensuring that we have that kind of standard policy within our healthcare facilities. Because hospital-acquired infection, can happen if you don't have the access to consistent and water. And of course, finally, water is life, and clean water really means health. Thank you very much.
Thank you very much, Mr. Baker. Well done for you and Dr. Valeska. I did not hear exactly, though, a response to the question. The question is, has COVID-19 injected a new urgency for taking action to develop solutions to meet water demand? Clearly, from the presentations, worldwide, there are still a lot of people who do not have water, and that has become an issue. And Dr. Stempley demonstrated that with some statistics that she shared with us worldwide, and even down to the Caribbean level. So clearly there is the need, and this need has been there prior to COVID. Mr. Baker presented that indeed in Jamaica, Jamaicans have improvised in ways and means to use water, even when they do not have running water. He highlighted the need for conservation of the available water. Mr. Baker also mentioned about technology to augment water supply to health facilities. So my first question to both panelists would be, could you give us an impression of a direct answer to the question of the panel? And if you want me to read that again, it is, has COVID-19 injected a new urgency for taking action to develop solutions to meet water demand? So may I start with you, Mr. Baker?
Okay, well, I would say that prior to COVID and as a developing nation, there's always a challenge with piped water. Because from the starting survey that was done, I think it's 2011, which provided that we have 881 households, quite a number, only probably 60% have access to piped water. What we are saying is that COVID would have highlighted the real need for us to have a build out of the water and water distribution in Jamaica because of course the demand. We need a sustained demand of water to maintain sanitation. So we have resources, and I guess WRA would have highlighted that, but we need this kind of build out to provide the kind of access so that all the areas, legitimate areas that require the piped water will have access and can get it when it's needed.
Thank you. Dr. Valeska, how would you respond to the direct question?
Oh, yes. I think the data that I brought shows that, right? We already have a gap that need to be filled with strategies for access to water in health facilities. And COVID brought to us the need for that to be amplified also for other facilities that we, such as schools and public areas. So yes, and the need is really big. However, we still have data missing to know how big is this demand. We can estimate it, but we don't have, in many regions in the world, we don't have the real concrete number to be able to reach it.
Thank you. Let's go to the question and answer tab. What we have here from Kwame Emmanuel. Are wastewater treatment facilities in the region testing for COVID in wastewater from residential communities? Given this is regional, may I ask you, Dr. Stempliwik, to take this question?
May you repeat? Sorry, is in here in the questions and answer?
Yes. Are wastewater treatment facilities in the region testing for COVID in wastewater from residential communities? Is the question.
Yeah, so this test, the test for waste is done based on research. So as I think Mr. Baker also mentioned that at the beginning we saw that although we can find virus on the wastewater, it cannot be transmitted through that. So there was and there is some research on this area. However, there is no recommendation for regular sampling and surveillance of these viruses on the water, differently from other diseases that can be transmitted through the water. The COVID-19, SARS-CoV-2, the virus is not the case. So the data comes from research.
There's also a question here from Kwame Emmanuel as well regarding PAHO. It says, does PAHO do any work in hospital business continuity planning related to climate-related impacts? Example, flooding of health facilities related to rainfall events?
Yes, thank you for the question. PAHO does important work with partners about resilient hospitals that also Mr. Baker mentioned. And this is in the whole Caribbean area, and to build green and safe hospitals that will be resilient against the climate change problem that we can have. So yes, PAHO has an important program in the region to build resilient hospitals and green hospitals.
Very good. And to you, Mr. Baker, let's put this question in the context of Jamaica. Has there been any spatial analysis looking at COVID hotspots and areas where water supply is unreliable?
No, with the data, there's the EPI unit does the spatial analysis of the COVID and cases and the distribution. But I don't think there was any correlation between the water distribution or the water availability in those areas. And that would be an interesting research to look at the areas that have little access to water and the relationship between the number of COVID cases. But there's no mapping of the hotspots in that regard.
Very good. I think that concludes the questions we have online on the chat. Let me see, that was Q&A. Let me see what is there in the chat. We have quite a bit of commentaries, but not so much direct questions that I think would be for this panel. I think an overriding question, given that clearly there is this demand for water that has been exacerbated by COVID-19. Clearly there is need for attention to potable water supply. Where I work more on the infrastructure side, seeking to improve efficiency of delivery of water supply, not only to homes, but to all facilities, including hospitals. The utilities, not just in Jamaica, the NWC, but utilities across the Caribbean are wanting for improvement in efficiencies. As I read in the preamble, there is quite a bit of need to attend to the water situation. In many cases, including Jamaica, sufficient water for the population is certainly produced. However, much of that water becomes non-revenue water, and a significant portion of it, based on our studies in Jamaica, is actually real losses. Those are losses from leakage and that kind of spillovers and that kind of loss. So there is indeed the need for investments, and as I also indicated, the political directorates, their position is that, the current position is that they will aim to corporatize and privatize NWC to seek to achieve that efficiency. But the crux of the matter is that indeed there is need for that investment. And until that investment is applied, there will continue to be this issue of shortages. I reflected a bit on the sessions yesterday, and what really caught my attention was a statement made by Dr. Witter, Michael Witter, that water really should be central. If water is central to life, our existence, then there would be higher priority placed on water improvements, water supply improvements. So that's a big if, and perhaps this conference could take this issue to the directorates to place water in a higher priority level than what it enjoys at this point in time. Until that happens, other competing priorities, which are very important, financing to schools, dealing with crime, those kinds of issues are competing with the need for improvement in water utilities, given that the water utility is solely government owned. So any final word from you, Dr. Valeska, and then Mr. Baker?
Thank you. Yes, no, just highlight what you already said. So for health service, health system, the wash is also vital to guarantee the quality. And it's an investment that you may see in very short time that you are saving, investing in the wash in healthcare settings and also other public settings. Thank you.
Right. Yeah, just like to say, I'm happy for the JN Foundation and this summit, and I would love to see this kind of delivery among other stakeholders on other health issues, or not just health issues, but some critical issues that affect us all, to keep it on the front burner. The water and sanitation, water is so essential to the reduction of diseases that it is necessary for us to have it on our agenda and going forward. And when we resume after COVID, we want to ensure that we have it on the agenda as an important priority. Thank you very much.
With that, we hand over to JN Foundation. Thank you very much. I think this was quite interesting, and I hope our audience got some fruit out of it. Thank you.
Thank you.
Thank you too.
Good afternoon again. We have come to the end of all the presentations on this day 2 of the JNF Water Summit, and it was a very good presentation, though as Mr. Caetano stated, there was a need to put a definitive answer to the question, has COVID injected a new urgency in meeting the water demand? Let me just give you some data on water demand for COVID with comparative periods pre-COVID. In California and San Francisco, the research indicated that from March to July 2018 and 2019, compared to March to July 2020, same period in terms of the abstraction, the demand for water, that the demand for water rose 20% during those period between March to July 2020 compared to the other 2 years. Thanks. There was a small decline in a small increase in single-family residence, 23% increase in multifamily residences, and significant decline in commercial and schools of between 6 and 22%, depending on, because they were closed, schools were closed during a lockdown period. In terms of 5 water utilities across the United States, one was in California, one was in Arizona, one in Georgia, one in Colorado, and one in North Carolina. Residential water, which varied from 12 to 52% of the water supplied in any one of those water utilities. That the water consumption rose for residential which comes after the lockdown and declaration of the pandemic. And there was a significant rise, as much as 400% in some cases, where people were locked down. What is interesting, and which I think we would like to really get some information from NWC, is that while net billing increased, revenues did not increase due to economic conditions of the pandemic, because nobody was working, so they could not pay their water bill. So while demand increased, billing increased, revenues did not increase. So clearly, I think if you're in a situation where you have a shortage of water, or you're in a dry season like we are in Jamaica now, clearly the COVID has injected a new urgency, as far as I'm concerned, in ensuring that we can meet the demand, since washing and hygiene is clearly a major criteria of reducing the cases from the pandemic and the number of deaths that take place when you do that in conjunction with the other protocols, such as masking and maintaining your social distance. So for me, I think, yes, COVID has injected a new urgency, and I think that as more data becomes available, we will see that the assumption that it has injected a new urgency, yes. Well, in terms of wrapping up the entire 2 days of the pandemic, of the JN Summit, sorry, my apologies. I think we have covered a lot of ground in different areas, and there are some issues that I think government needs to look at. I've been trying to put together some actions that government need to take. In all the sessions that we had and the panel discussions, the themes of planning, conservation, and climate change resonated. These affect water availability, water security, and overall national development. While the issue of planning was discussed on day 2, the Water Summit, it clearly must occupy the priority position in the successful management and development of our water resources. For planning to be effective, it must be proactive, not reactive. If we are being reactive in our planning, then that means that we're trying to catch up. And you can't catch up in the very changing environments that we have these days in light of the pandemic and climate change. The opening presentation by the Minister, Honorable Pernell Charles Jr., spoke to the need for planned housing as an enabler to Jamaica's climate resiliency. He looked at it in terms of reducing squatter settlements and the disaster risk associated with such informal settlements. Because these are the people who build on gully banks up in the Hope River, and you have serious problems. When it rains, they get flooded out, they get washed away. Then it creates a problem on government to relocate them. Some of them don't want to be relocated. Some politicians don't want them to be relocated either. So therefore, it creates a big problem for them. But in the past, we have had several plans developed. We have a water resources master plan. We have a national irrigation development plan. We have a water supply plan, just to name a few. However, there was no real integration of these plans. Government in its Vision 2030 plan has stated that the objective of universal access to water for all Jamaicans must be achieved. This objective may not be met with a multitude of separated plans unless there is some form of integration of all these plans. The National Water Sector Policy was a tool that was prepared setting out how the government would meet the objective of universal access to water for all Jamaicans. There are, however, several elements of the policy that have to be implemented if the objective is to be achieved. These have not yet been done, and it may take several years for implementation, and for the policy to get any form of success. The case for water conservation was mooted by the installation of water-saving devices in houses as a minimum standard for all housing developments. The installation of these devices would lead to a reduction in the demand for water, a more efficient use of water, and which would benefit both the utility company that provides the water, would reduce the bottom line of your water bill, and at the same time would ensure that the utility can provide water in the ever-changing climate scenarios that we are seeing as we go along. Water security, which was discussed this morning, pointed out that there's a need to look at security from the infrastructure point of view, where we have leakages and losses, significant losses. The NRW program undertaken by the National Water Commission, which has so far been very successful, indicates that it's a step in the right direction. And though the NWC was lambasted by several media persons for entering into this $42 million US contract with Maya, I think they have proven that it was worth the while, and the savings, and based on the discussion and the information given by Mr. Barnett this morning, clearly that program has to be expanded to other areas. I distinctly remembered when we had a French group here that did 4 parishes in Western Jamaica, and I was on the board of the NWC at that time. And they went through in terms of leak reduction, meter replacements, and all sorts of things. The significant savings that was made in terms of the volume of water that had to be supplied to in Hanover, Westmoreland, St. James, and Trelawney meant that we were able to meet the demand without increasing the volume of water, simply by reducing the losses. And at the same time, by the metering was able to increase the billing and the collection of revenue that enhance the National Water Commission. And I think that is the area we have to go. We are now moving the NRW program into Portmore, and I'm hoping that we will see the success there once it is completed. But it's certainly not an overnight program, but it's a program that is clearly needed and was referred to by both Drs. Cashman and Farrell this morning in their full discussion on water security issues that they had to look at. We have to look at in terms of adequacy of resources. Yes, Jamaica has more resources than a lot of the other islands, but if we don't use it efficiently, if we don't protect it from contamination, then we are certainly going to have a problem with security, because 2/3 of Jamaica is limestone, and 80% of our water resources comes from the limestone aquifers across Western Jamaica. Dr. Cashman referred to that this morning also, and he pointed out that if you don't control the discharge into the aquifer from industrial waste, and we have seen it from the bauxite alumina industry, where we have had contamination, where you have bauxite alumina plants in the past where the hydrological and geological knowledge was very, very poor. But since that time, we have made significant steps in ensuring that there's an improvement in the disposal systems by going to disposal methods. And in fact, we have seen significant cleanup of the resources, enhancing the safety, the security of water. The issue of sewage treatment, where it is there are very few sewage treatment plants across the island, and people tend to put soak-away pits in their backyard, and where it's in limestone, of course it disappears fast, and that's what you want. So you don't have to worry about it, but it's going to come back and haunt you. And I tell you, there's a lot of people living up on the hills there who is discharging sewage in soak-away pits up on the hills around Kingston. And the wells at the bottom of the hill is pumping that water back up to the top of them. So be careful up there. So we have to understand that what goes down is going to come up back. So we need to ensure that we have that security in dealing with water security. Of course, cyber security is critical, And as I pointed out, in December 8th and 9th of this year, there will be a virtual meeting in Guayaquil in Ecuador, in which you can put in your diary, and I will give you further information as we get the information on this. We're looking at cybersecurity for water security. And again, I repeat the case in Florida of the hacking into the water treatment plant and things. In terms of water as an economic good, while there was no definitive answer for either way, I think it's a little bit of both. Clearly, you need water to drive economic growth, and you need it toward national development. But you also need to provide water for health and sanitation. And there are people who are not going to be able to afford to pay the full cost of water. So we have to look at some areas. But people have to be educated in two things. One, the impact of climate change, and two, how they use water. There are many areas in Jamaica, and I remember one area clearly where we did a audit of a lot where there was about 40 houses in there. It's one number at the road, you know, one single number, like 113, whatever it is, Tom Stroke Road. And you go down there, it's like 40 houses in there with 200 people living in there. And they have one pipe going inside there, and everybody is on a flat rate. But when you put a meter on there, my God, they're using 4 times the volume of water that they're actually paying for, because they're not paying for the true cost of the water. So the water is wasted. This is something that we have to look at closely. Yes, we have to provide social water, but at the same time, they must realize that they have an obligation to use that water wisely. And somebody has to pay for that water. In fact, in the first water sector policy, and let me tell you, I drafted the first water sector policy and sent it to government, who then got the IDB involved in putting the policy together for the first water sector policy, which was revised in 2000 or 2010. The government undertook and gave to the NWC a commitment that it would pay for the social water, and it was stated in the policy and things, but that was never lived up to. But we have to get these people educated, and I think they have to understand what the impacts of climate change are going to be and how it's going to affect the provision of water for their own health and sanitation. And of course, Lynette Vassell pointed out that there is a need to treat water as a human right. This was declared in the Hague Declaration, which Jamaica signed on to some many years ago, when we had a water summit, a large international water meeting in the Hague in the Netherlands. And Jamaica signed on to that declaration that water should be a human right. And I don't think really that government has lived up to that, but it's certainly something that has to do. People have to get water. They have to have access, safe access to water. They have to have water of good quality that will not cause problems, health problems for them. You can't be drinking from an almost stagnant stream or taking water from a stagnant stream if there's no other source. There has to be some provision of water and things. This will take time and investment, but it's something that has to be done if we are really going to meet the whole universal access for water. Now, there are some actions by government that I think they need to look at. I've jotted down a few here, more I will work on in the final report that will come out. But I think government has to create an integrated planning to ensure Vision 2030 Goal 4 can be achieved. That is the universal access to water for all Jamaicans by 2030. The piecemeal planning is not going to work, and the reactive type of planning is not going to work. We need to facilitate the installation, governments need to facilitate the installation of water-saving devices in all houses that are going to be constructed from now on. Government is talking about building 70,000 houses that are affordable. Affordable, that means just the structure, but it means that the resources that goes into that house to make it a home is like the water and the electricity has got to be affordable. And how we do that is very critical. And over time, we need to replace all the non-water serving devices in some of these old houses where you have big flush tanks that hold 4 gallons. I mean, when you 4 gallons per flush, when you can flush with just 1 gallon and things right now. And so we can do that through public-private partnerships, as was suggested by Minister Charles. And we can look at the water utility working with the customer and an entrepreneur like Instant Save, for instance, who participated in the discussions, amortizing the replacement costs on your water bill and have that paid over time so it doesn't cost the consumer a lot of money immediately, but it allows for more efficient use of water resources, benefits the country in the long run without taxing the consumer and at the same time providing employment and economic activity for a private enterprise. Government needs to provide incentives for farmers and housing developers to finance technologies that would improve agricultural production and the provision of residential housing. I think basically there was Dr. Stanbury raised the issue of government providing incentives for reducing the tax that may come on drip irrigation systems, for instance, that would allow farmers to be at the highest level of efficiency. And a long time we have been saying that maybe we need to reduce some of the taxes on water saving devices, and also on people talk about LED bulbs and things where prices have gone down significantly because of the need to save energy. But I think we need to look at that, and government needs to provide that clearly to push national development growth and economic growth and job creation, which the Minister Auburn Hill took. I think I wasn't pushing job creation. The government needs to implement elements of the national water policy that prevent the successful execution of the policy and achieving its goals. After implementation, we need to ensure that we monitor and evaluate whatever changes are done to ensure that we are on the right track. We just don't make changes and leave them. And we need to ensure that when changes are made, the changes are useful and the changes are beneficial to everybody, including the government itself and the country. Government must ensure that water is recognized as a human right. I've set that out before. I've set out in the international declaration signed by the government, and that must include provision of adequate resources, both in terms of quantity and quality and safe access to these resources. So there are other actions that I think can be taken, which we will develop in the next week or two as I produce this report that summarizes all that has happened and all that we hope that we can push and have these incorporated and placed before the government as critical and necessary to ensure that we have safe, reliable, and resilient water supplies. In light of climate change, this is critical, it's very important, and if it's not done, the slow-moving train is going to catch up to us, and the slow-moving train is going to kill us. So climate change now gives you time to take action, and that action has to be taken now before the train actually gets to the rail crossing and you don't get over the train line. So ladies and gentlemen, I want to thank you for your participation in this summit. I think JN Foundation deserves a big salute for sponsoring this summit at a very critical time in our in the pandemic and in light of our climatic conditions. And I think that we need to go a step further in probably having specific discussions with certain parties who participated here in the summit to develop in more detail the need for action to be taken and how we can get those actions done and where can we seek the funding internationally, locally, to fund those actions that are needed and critical to that. Again, thank you very much, and I wish you all a good weekend and take care as you go along. All right, thank you.
Well, how time flies. But that is what happens when you're having fun and doing productive work. Ladies and gentlemen, we have come to the end of our two-day water summit, and from all accounts, a very useful event where practical recommendations flowed like crystal water from both our experts and our participants. This augurs well for the proceeding which will be prepared as a solid declaration from this summit. But this summit would not have been possible without a highly passionate and committed team from the JN Foundation, led by Claudine Allen with Cornelia and Omar, and a support team who made the magic of the virtual webinar work so well for us over the past 2 days. The support of our partners was outstanding, and we thank them sincerely for seeing it through to this point. And hopefully, like all good shows, that we can look forward to the sequel. Right, Cerise? I hope you're listening. We're most grateful, of course, to the stars of the show at the summit, our special speakers and panelists, and important presentations by our critical policymakers in the form of our 3 ministers, who saw the importance of this initiative and chose to participate fully. We do hope that they will continue to be champions for us to make these things come to fruition. And we will, of course, give all the support that is required and that they will need. Of course, it would not have been complete without involvement of you, our important participants who joined us by Zoom to make the virtual session a real success. I have saved the last token of gratitude for a wonderful rapporteur. Wasn't he just wonderful? Truly our own waterman. And his job is still not done, as he will be putting together now the final report for our declaration. As we say farewell to you from near and far, remember that we all now have a mission to make reality of our deliberations, which are made at this summit. And remember, we have a plan, we have to plan and not react. Thanks for all you who participated. Keep safe and good speed. Thank you very much.